Good afternoon, everyone, and thank you for joining us here at the State Emergency Operations Center for the latest updates on COVID-19. Joining me today are Major General Michael McGuire, Secretary of State Katie Hobbs, Wendy Smith-Reeve, Deputy Director of the Arizona Department of Emergency and Military Affairs, and Kimber Lanning from Local First Arizona. Along with Sandra Watson, President and CEO of the Arizona Commerce Authority, and Dr. Cara, Director of the Arizona Department of Health Services. Just a few minutes ago, I was able to tour the State Emergency Operations Center, and I'm impressed and grateful for the important work that's taking place there and the dedicated public servants who are putting in long days. At the center, we've trained and experienced professionals working 24/7 to help coordinate emergency response around the state. These professionals coordinate communications among all of Arizona's 15 counties. They conduct outreach to rural communities and organize resource management and deployment. And they ensure that Arizona is acting with one voice and one clear line of direction as the situation changes, sometimes by the hour. Today, I want to thank all the emergency management and public health officials who have stepped up and made combating COVID-19 their main mission. I also want to thank Director of Emergency Management, Wendy Smith-Reeve, and everyone on her team for working incredibly hard behind the scenes. COVID-19 has been an unprecedented challenge, and you are all rising to the occasion. Now, without a doubt, COVID-19 will test our limits, but it's not going to break the state of Arizona. We'll continue to be proactive in our approach. We're going to act urgently, and we're going to prioritize public health in all of our decisions. Already, the outpouring of support and help has been tremendous, coming from all over. Businesses, nonprofits, educators, law enforcement, and everyday people. As the facts change, a few things will remain the same. We will continue to make the health and safety of Arizonans our #1 priority and our guiding star. And we'll continue to get through this. And like I've been saying, we're going to get through this together. From the beginning, our office has remained in close contact with Dr. Cara and her team at the Department of Health Services and public health experts at the Centers for Disease Control and Prevention and the National Institute of Health, as their recommendations have evolved to match the facts on the ground, so have Arizonans, and that will continue to be the case. Yesterday, the Department of Health Services updated its guidance related to bars and restaurants, child care providers, and nursing homes, as well as implemented enhanced social distancing measures. We're grateful for the compliance that's already taken place, and I encourage all Arizonans to review these recommendations and continue to act responsibly. We also know that many small businesses are already feeling the impact of closures and reduced business. That's why I sent a letter to the Small Business Administration earlier this week requesting an economic injury disaster loan declaration for Arizona. The declaration will help small businesses impacted by COVID-19, and we hope to see this request approved without delay. In addition, yesterday, our state held a safe and successful presidential preference election, and my hat goes off to Secretary of State Katie Hobbs for the tremendous job that she did. She and her team worked closely with my office, public health officials, and county leaders to implement a series of important safety precautions that prioritized the health and safety of poll workers and voters. Because of that, Arizonans have the opportunity to participate in the most fundamental part of our democracy and make their voices heard. Now, before I hand it over to Dr. Christ for the latest updates, people have been asking me how they can help their communities. Here's what you can do. You can donate blood, you can donate blood. Blood levels are dangerously low at our blood banks. The latest numbers show that 32 blood drives across the state have been canceled. Because of that, over 800 blood donations were not collected. So please, if you're healthy, consider donating blood. Also, our food banks need your help because our most vulnerable need their help. I encourage Arizonans to contact your local blood bank and food bank so you can see how you can help on these two fronts. Once again, I want to thank all of those who are holding our communities together at this time. Community leaders, nonprofits, law enforcement officials, doctors, nurses, our faith community, pastors and priests, and our grocery store workers who are working incredibly hard to keep the shelves stocked and working around the clock to meet the demand. As the situation changes, I want everyone to know in Arizona that this will remain our top priority. We're focused on COVID-19 24/7 at this time. We know we could be dealing with this for a while, for some time into the future, and we are prepared to use every tool in the toolbox as necessary to protect public health. And now I'm going to turn it over to Dr. Christ for an update on the very latest with COVID-19. Dr. Christ.
Thank you, Governor Ducey, for your leadership and making the health and safety of our communities the top priority of your administration. And I want to thank DEMA Deputy Director Wendy Smith-Reed for her partnership. She has been with us through the beginning and has helped us with this response to the COVID-19 outbreak. ADHS activated our Health Emergency Operations Center on January 27th after we identified the first case of COVID-19 in Arizona. My team at ADHS has been working nonstop in response to the outbreak to ensure we keep our communities and families safe. Since the start of the outbreak, we have been in constant communication with DEMA, and they have assisted with coordinating statewide resources to help other agencies and local partners respond to this outbreak. On March 11th, Governor Ducey declared a statewide emergency and issued an executive order to respond to the COVID-19 outbreak. With that emergency declaration, DEMA fully activated the State Emergency Operations Center. The State Emergency Operations Center and our Health Emergency Operations Centers have staff working together so we can coordinate the statewide response and ensure we're protecting our communities while having a minimal impact on Arizonans' daily lives as possible. I want to provide the latest information about the spread of COVID-19. To date, we have 27 cases. There are 11 cases in Maricopa County, 8 in Pinal, 1 in Graham, 2 in Navajo County, and 5 cases in Pima County. Arizona has community spread of COVID-19, and we are expecting more cases. Because of this, there is a heightened level of risk of COVID-19. Our goal is to mitigate the spread of the disease and lessen the impact on the people at the highest risk for serious complications. And people at the highest risk are older adults and people with underlying medical conditions like heart disease, diabetes, or lung disease. My team has been working tirelessly to ensure that Arizona complies with the new guidance provided by federal health officials this week. Federal officials are now advising the following. If someone in your family has tested positive for COVID-19, keep the entire household at home and contact your medical provider. We strongly recommend that dining establishments in areas of known community spread discourage dine-in traffic and instead provide curbside pickup or drive-through service. Do not visit nursing homes or retirement or long-term care facilities unless it's to provide critical assistance. Employers should develop protocols to work from home when possible. For those workers in our healthcare industry and pharmaceutical and food supply, your continued service is very important. We need this community to maintain their normal work schedule and follow CDC guidance to protect your health while you are at work. Everyone should avoid social gatherings in groups of more than 10 people, and we recommend avoiding discretionary travel, shopping trips, and social visits. As Governor Ducey and Arizona Superintendent of Public Instruction Kathy Hoffman announced on March 15th, Arizona schools are currently closed statewide through Friday, March 27th. We encourage people, particularly high-risk individuals, to have supplies on hand, such as extra prescription medications and over-the-counter medications. Take everyday precautions, such as avoiding people who are sick, washing your hands often, and cleaning and disinfecting high-touch areas in your house. Stay away from crowds if possible, and have a plan if you get sick to call your healthcare provider, and to identify who else can care for you if your caregiver becomes sick. To stop the spread of COVID-19 and to protect our most vulnerable community members, we ask everyone to routinely implement infection prevention practices. The best way to prevent the spread of respiratory viruses is to do the following. So wash your hands with soap and water for at least 20 seconds. If soap and water are not available, make sure you use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, or mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue and make sure that tissue makes it into the trash can. Clean and disinfect frequently touched objects and surfaces. And if you need to see a healthcare provider, consider using telemedicine. We urge everyone to find the most up-to-date and accurate data from reputable sources about COVID-19. You can visit our website at azdhs.gov or the CDC at cdc.gov. We also have the Arizona Poison Control System partnering with us to provide a hotline for the public and medical providers, and this hotline can be contacted at 1-844-542-8201. And I'm now going to turn it over to Secretary Hobbs.
Thank you, Dr. Christ, and thank you, Governor Ducey, for you and your administration's support as our state carried out the presidential preference election yesterday. I want to take a moment to thank and acknowledge the county elections officials from all 15 counties who, from all accounts, executed a successful election that exemplified the best of who we are as a state. Carrying out an election is challenging in the best of times, and the professionalism, calm, and determination of our local elections officials was key to the day's success. I also want to honor and recognize the poll workers, judges, inspectors, marshals, and other paid and volunteer staff that helped our democracy function yesterday. Of course, we are here today at the State Emergency Operations Center, and the folks here were also instrumental in assisting us and the local officials with ensuring a successful day of voting yesterday. We cannot thank the Department of Emergency Management enough for their support in ensuring that polling locations across the state would have the resources they needed to ensure they met the CDC guidelines for cleaning and hand washing. In order for voters on the Navajo Nation to have access to voting, many chapter houses across the nation are used as polling sites, which is a wonderful partnership between the counties and Navajo Nation. Many of these locations, however, lack hand washing facilities. So Wendy Smith-Reed connected us to one of the state's vendors, 310 Dust Control, and they jumped into action. To say they were fantastic is an understatement, and I especially have to recognize James Cantelmi individually. After spending the day Monday rounding up remote hand washing stations, throughout the night Monday night, 3 teams of trucks and crews delivered 40 hand washing stations to chapter houses across the 3 counties of the Navajo Nation in time for the polls to open on Tuesday. Additionally, when other vendors that James works with heard what he was doing, they offered supplies of Purell pumping stations for 50 of Maricopa County's highest traffic polling sites. Monday night, they were putting together stands for the pumps out of materials from Home Depot and delivered them overnight throughout the county. Thank you so much, 310 Dust Control and the others who pitched in to help. On top of that, when I got word that another county had a shortage of cleaning supplies for their polling locations on Tuesday morning as the polls opened, Wendy connected our staff to emergency management for that county. And within 2 hours of polls opening, county emergency management was deploying cleaning supplies to the over 50 stations in that county. So when I say that DEMA and their resources came through, they came through in a big way, and I am so thankful for your efforts. The counties are thankful, and you should all know you helped ensure that democracy won the day. I also want to mention that the Secretary of State's office has diverse responsibilities, which include the Business Services Division. My office assists small businesses throughout the state with trademarks and trade names, UCCs, partnerships, notary certifications, and more. My office has been working to continue to meet the needs of Arizona's small business community, and so we welcome the efforts to provide relief to this group that is being so impacted by this pandemic. We hope that the public will support our efforts to keep our staff safe and healthy, and will utilize the availability of services on our website at azsos.gov/business. These are unprecedented times, and we are rising to the challenge united in our desire to protect all Arizonans' health and safety. I encourage all Arizonans to heed the advice of experts. Stay home as much as possible, use social distancing, and wash your hands and surfaces frequently. Now is the time to recognize our interconnectedness and how we all have a responsibility for one another. I know I will be holding all Arizonans in my thoughts as we all continue to navigate this pandemic. Thank you.
Good afternoon, everyone. My name is Wendy Smith-Reed. I serve here at the Department of Emergency and Military Affairs as the Deputy Director, as well as the Director for our Division of Emergency Management. First, I want to thank Governor Ducey, Dr. Cara, Major General Michael T. McGuire for their leadership and support. Our organization does stand ready to fully support the Governor's robust action plan to protect the health and welfare of our state. When our whole community works in concert, together with one another, we can overcome any challenge. The State Emergency Operations Center, in conjunction with the Health Emergency Operations Center, is the heart of the state's emergency response for this event. We hear the reports of elders in our communities struggling to get necessary supplies, hospitals doing their best to be ready for response, small businesses being impacted, and people just feeling scared. The problem solvers in these EOC facilities and beyond are giving all they can to tackle urgent community needs such as these. Representatives from the Arizona National Guard, state agencies, and volunteer and private sector partners can communicate and coordinate with each other both virtually and in person at this facility, working together to find solutions during this crisis. Although a pandemic might feel a bit unusual and like uncharted territory, we've practiced for these situations. And in the same coordinated fashion that we are working today, collectively and collaboratively, we will remain committed to getting through this together. And it's through that partnership that we will be successful. And I'll turn it over to Kimber Lanning with Local First Arizona.
Thank you. We always say it, and we can never say it enough, that small businesses are the backbone of Arizona's economy, all 500,000 of them. It's crucial that we show up for them now, and the millions of Arizonans that they employ. I want to thank Governor Ducey for his swift action in making sure federal help is secured for our Arizona businesses, but we need to show up for them now, where it matters most, here at home in Arizona. These last few weeks have been very scary for all of us, but especially for small business owners who at the end of the day are everyday people who care deeply about the communities they serve. We've heard from small businesses ranging from catering companies all the way up to Mason, who have lost all of their catering contracts for the foreseeable future, to boutique hotels in Tucson that are seeing six-figure drops in revenue overnight. The government funds our governor is working to secure will make it available that are critical for our small businesses to sustain themselves and their employees through these difficult times. Our overall health as a state and economy are on the line. We all have a role to play in its immediate future. Small businesses are the most creative and hardworking people we know. They've stepped up to this challenge. Just last weekend, we saw immediate implementation of curbside pickups with restaurants, virtual shopping with retailers, voluntary shutdowns for the health and well-being of our communities, and special discounts offered for doctors, nurses, and social service providers. Everything imaginable these businesses are doing to ensure the health of others during this difficult time. At Local First, we've seen an outpouring from those business owners who are willing to help each other, including offers of free delivery scooters. We have a scooter company that has said they have 4 scooters available with hot pockets and ways for restaurants to do delivery if they're not equipped to do so. We've seen business consultants willing to donate their time and support. We have a group of CPAs who have stepped up to offer their time to help small businesses fill out the necessary forms and requirements to apply for SBA loans. We have businesses purchasing and having food delivered to hospital staff. Business owners willing to volunteer for nonprofits while their own businesses have been shut down. I'm going to take this opportunity to ask people at home, if you have the means, support your local businesses now. Order lunch to go or for delivery, buy a gift card, share a story of a business on social media. Something as simple as that can make a big difference. Let's make sure every one of them makes it through these tough times. And for business owners, whether or not you've been a member of Local First Arizona, doesn't matter. I encourage you to follow us on social media. We are collecting and distributing information at rapid speed. Visit localfirstaz.com. We have a new page that is dedicated to resources available to small businesses, any sort of assistance that is available in rural and urban areas alike. I want to thank you, each and every one of you, for your help at this time. I'll hand it back to Governor Ducey.
Thank you, Kimber, for being such a outspoken ambassador for the small businessmen and women of Arizona and for their employees. With that, we'll take some questions.
Let's start over here with Ryan and we'll go around.
Governor, do you have any plans to help Dr. Christ with additional staffing at DHS or finding someone else to run DES while we're in this pandemic?
Yes, we are going to, whatever Dr. Christ needs through this crisis, we will be there in the governor's office, and we will have an announcement on DES tomorrow.
Governor, Ryan, I was going left to right or right to left, depending where you're standing. Governor,
Let me check that. Patrick, are we going to have the announcement on DES tomorrow?
we'll get back to you about that. Yeah,
It's going to be very soon.
very soon. Governor, the mayors of the state's 2 largest cities, heeding the advice of CDC and even Dr. Christ in terms of group gatherings, decided that the best thing to do would be to close places of these kind of mass gatherings. You so far have chosen not to. What do you know that they don't know?
I am following the guidance of Dr. Christ and the Centers for Disease Control and the National Institute of Health. Our decisions have been guided by subject matter experts and informed by the facts, and they will continue to be that way.
Except that, let me just follow up real quickly, but the fact is people are, in the cities that are not affected, still going. We had some lawmakers last night tweet out that they're at a bar and poking fun at the whole thing. So without any teeth, this seems like it's nice to advise them, but your people are getting into situations where they can communicate.
There will always be bad actors in any situation. What we want to do is put out responsible guidance for the entire state of Arizona. We want to make decisions that protect public health first and foremost, but also take into account that we have a large state and things are different in Tombstone than they are in Tucson. They're different in Gilbert than they are in Globe. I'm going to respect local leaders' decisions, but the decisions that we make from the governor's office are statewide. And these are the responsible guidance and direction for our state at this time.
I have questions for both of you. I'll list them off. Governor, are you going to call out the National Guard? Should we be sheltering in place? Should we have widespread medical triage. What are you asking from the federal government? Are you asking for mobile ICUs? Are you asking for tents, setups, more beds? What are you asking? People are panicking. They're not hearing the message not to fear. You are suggesting things. What would you say?
Well, I want to say to all Arizonans that we're going to be very transparent. You're going to know what I know. We've been holding these press conferences on a daily basis. What we're asking for from the federal government, I'm going to defer to Dr. Chris, but we have concern about testing. We want to make sure that we're good with ventilators. We do expect more cases, so we're working on hospital capacity. Our first thought every day has been around public health, and I want you to know that that's what I'm focusing on. It's my top priority, it's my team's top priority, it's Dr. Cara Christ's top priority. We also know there are questions around the economy, and we know there is a lot of concern in that regard. So we want to work with Congress and the administration on all these fronts, and we're communicating regularly with them.
What about the National Guard?
If we need the National Guard, I'll call the National Guard up.
We're hearing right now that this is happening in real time, that county leaders are telling healthcare providers that there is a complete interruption to the supply chain for testing, as far as swabs for testing, as well as the reagents. How can we say that there's minimal risk if there's no mass testing, we are not testing people, and the fact that the county is telling healthcare providers that they cannot test people and to tell people to go home and quarantine themselves?
We have been working with our federal partners to identify where we can get additional testing and collection as well as testing reagents. So there is a national shortage of both of those entities. We're working with our labs to identify what needs that they have. We were lucky to have Banner prioritized as one of those labs that will get a shipment of nasal swabs. So we continue to work on a statewide basis, but facing a national shortage of those supplies.
So then how can we test people?
So we have been testing people, and there has been community level over the last few weeks. There's a lot of things that we take into account as we look at the number of cases, and so we continue to make almost hourly assessments of where we are and what we're seeing based on syndromic surveillance, our number of cases, and other information that our epidemiologists are reviewing.
But if we're not testing people, how can we say minimal risk? And why are we just suggesting if we're not testing and just telling people as a suggestion not to go out? Why are we not directing this?
So it is a recommendation that people stay in. We understand that there are opportunities where people may need to go out into the community. At this time, we're encouraging everybody who is not feeling well to stay home, and if you have, if you're living with somebody who has viral respiratory illness symptoms such as cough, fever, or shortness of breath, they need to stay home, and the home should stay home if they can't be tested. Testing will not change the medical management of COVID-19, so we would encourage people that if you can stay at home and make sure that you get better.
Peter, go ahead.
Along those lines, Dr. Chris, do you think that if the state and federal authorities have accepted the testing kits from the World Health Organization that other countries have been using since the end of January, we could have stemmed this pandemic in this country, as opposed to waiting for the CDC or the FDA to give us testing that we could use locally?
Well, I love data, and I want to have as much public health surveillance data as possible. I think that the containment of respiratory illness is very difficult just by the way that it's spread. The test will tell us where it is in the community, but again, it doesn't change our recommendations or our or people shouldn't change their hygiene, so they should be washing their hands frequently, whether it's flu, whether it's COVID, and it doesn't change the medical management of them.
We'll come over here and then we'll go to Brad.
For the governor and for Chris, where can you give us specifics on if people want a test, where they can go to get a test? Because we're hearing that as well. That healthcare providers send them to the county health send to urgent care. People can't get a test. We're also hearing that we've only tested 200 people in Arizona. That seems relatively low, wouldn't you say?
So that number is not inclusive of all of the community testing that is going on. So we do have more cases that have been testing, and we've been working with labs to get the denominator data to identify. What we would recommend is if your healthcare provider cannot take the swab or do the testing, call an urgent care to see if you can get in there. We will be working with Banner to post those field or alternative testing sites so that individuals who are symptomatic can go get tested.
Do we have any idea on when we'll have enough tests for everyone in Arizona?
That is something that we're still continuing to assess with that national shortage. That's why we're prioritizing those with either high risk, who are symptomatic, or those who are symptomatic and referred by a healthcare provider.
Rand, how severe is the shortage of swabs here?
I don't know what our current providers have. So we currently, as a state public health lab, we are prioritizing those high risk with those risk factors. We have enough to test 1,900 people.
But commercial labs, doctors'
Commercial
offices.
labs, that is, I don't have a total on that. What we are hearing is from our healthcare partners that they are having trouble obtaining those nasal swabs, but we did just get word today that Banner was able to get additional swabs for those field test sites.
And regarding the denominator, the number of tests the commercial labs are doing, that's a big question for Arizonans. Can you tell them now you're going to get that number, the number of tests commercial labs are doing, and post it within a few days, a week?
We are still trying to get our providers to report that information. I think we've got some, but not all just yet, but we're working with them to get them on.
And use your emergency powers to tell them to do it?
That would take an emergency rulemaking. We could do that, but
The governor could do it.
They're pretty happy to comply. It just takes a little bit for them to get that.
Question for the governor, if I can. I just got a call from a woman whose son owns a bar in North Phoenix across the street from Scottsdale. His bar shut down. He says and she says he did the right thing. And yet the bar across the street isn't shut down. We may be a big state, but we're a very big metro area where people are all right next to each other. Her question is, one person does what's right, her son, others don't. That's not fair. And she wants to know what you're going to do about it.
We're going to continue to be guided by the facts and the medical experts. The guidance that we have given is the guidance of the Centers for Disease Control, the National Institute for Health, and the Department of Health Services. That's what we're going to continue to do. We're going to ask people to act responsibly, and as necessary, we'll make different decisions.
And yet you have people from Phoenix going to bars in Gilbert, going to bars in Chandler, working in bars in Gilbert or Chandler, perhaps exposing themselves, exposing others.
We're doing everything we can to protect public health and also make the proper decisions for all people in Arizona across all backgrounds.
I'm hearing two messages, if I can. Sorry, last thing. Dr. Chris says, avoid gatherings of 10 or more. That's a bar. So how is your stance consistent with what Dr. Chris is telling us?
There are owners out there, and we've been working with the Commerce Authority to post the responsible owners and how they're doing it to avoid community spread, where they can keep facility open and still comply. You can go out in groups smaller than 10.
But Dr. Chris, isn't this a recipe for community spread, just leaving all these bars open?
So there are things that eating establishments can do to socially distance people who are in those areas. So we've made recommendations for currently for eating establishments that want to continue having a dine-in option so that they can ensure the safety of both their workers and their customers.
And we've also seen those voluntary closings across different categories.
Along those lines, you're a businessman, you believe in limited government. How much are you, when you're thinking about the forcefulness of the language that you use in your recommendation for bars to shut down, how much are you thinking about the effect on the business owners and your limited government, the idea to not have the government be overreaching?
Well, in this type of situation, in a crisis, there is a real role for government. As governor, I'm going to over-communicate, and we're trying to amplify what the facts are, what the science and data is, what the expert advice and counsel is. So my first concern is for public health. And beyond that, I do want to do the right things that we can navigate through this crisis to the best of our ability, understanding that things are going to escalate. We are going to have more cases. And then, of course, I've got concern for our economy and the people that work inside our economy. And I'm trying to make the most responsible, proactive, measured, and balanced decisions. But I will use every tool in the toolkit and exercise every power given to the governor when necessary.
You said things are going to escalate. You said earlier this is going to be with us for some time. Can you expound on that at all? How long is this going to be with us? And does the state have the capacity to sustain this level of intense disruption for months at a time?
I'm not going to make predictions. I just want to be straight with the people, with the citizens, and of course with the press. So I'm not going to make predictions. I just think that we'll be visiting on these subjects for some time. The state's in a much better fiscal condition than it was, but these will be challenging times. The social safety net will be stretched.
Governor, I have
How many of the 27 cases are community spread?
We are still investigating those because as they come in through commercial labs, we get notified as they're positive. So as the new ones come in, it's going to take us a day or two to connect with those patients. For the ones that were public health, we had one case that was community spread, and we continue to look at our commercial cases.
Governor, I have a couple of questions, and the first one is, as my colleagues are mentioning, the reality is there are people who are not taking this seriously. They're still going out, they're still partying, they're still not respecting the distance when they go out. We're not talking about work. If this continues to be a trend, would you consider doing the restrictions that leaders like in Phoenix, Flagstaff, and Tucson are doing?
The leaders in those municipalities have made decisions on their municipalities. My decisions are statewide, and I will keep all options open.
So wait, but I have another question, and this one is about Sonora. How are you working with the Sonoran government when it comes to border crossings? Because we are seeing their leader maybe not take the same actions that governors or even the president is ordering here.
Well, I have confidence that Governor Pavlovich will make the best decisions for the state of Sonora. We enjoy a wonderful relationship and friendship, and I'm going to err on the side of caution and public safety for the state of Arizona, and our two teams continually communicate.
But do you know if they're doing anything and asking their people to do anything?
Yeah, I was briefed on their situation. It's changing by the hour.
We're limited on time. We'll take one more from Howie, one more from Nicole, please.
Come on, yeah, I've got a question for the local Arizona. I appreciate all the things you're saying you should do for businesses. I appreciate the issue of the government applying for SBA loans. But talking about something even with a flat, whether it's a sharp curve or flattened out curve in the last months, what good is a loan if you have to pay it back even at zero interest? How many of the businesses that are here today are not going to be here at the end of this?
Well, I certainly can't make a prediction on how many will survive, but loans are very beneficial to get through with gap financing. So especially if we're looking at very low or no interest loans, which is what we're hoping for, they can be very beneficial, especially for the immediate needs of covering payroll, covering immediate orders, things like that. So for example, if a business has taken on a contract and is still waiting for the final 50% payment and they need additional resources to fulfill that contract and get paid, it would be essential, very important.
So why aren't more of your businesses doing the voluntary stuff that the governor suggested and actually closing up? Some of the businesses that are members of your organization are in fact remaining open, soliciting customers, advertising for customers, and that seems to be only making the problem worse.
I would agree with you. I'm not aware of those, and I would welcome a conversation with you. To the best of my knowledge, Local First Arizona has been distributing information to all of our members to ask them to respect the health recommendations that have been made. As the governor said, there are some bad apples out there that are not following that. What my focus is helping those businesses find new ways to do business, whether it be curbside pickup. As I mentioned, there are some that are doing virtual shopping. We're trying to help those businesses pivot and do business differently to the best of our ability.
Last question.
Dr. Chris, this one's for you. Since we're hearing that the supply chain is interrupted for testing, the largest health county is saying, don't wait for testing, telling providers that it's not happening. Can you say that people are going to be tested if they want and need a test? Can you guarantee that people in Arizona are going to be tested?
So those that are at high risk or those that are symptomatic will get tested. It will be a while before we can get the capacity to test every Arizona that wants to be tested.
So no.
Not at this time.
Thank you, everyone.
So I know there were a lot of questions around restaurants that are out there, and of course, anybody that is a bad actor or posting on social media is going to receive a lot of attention. I would like to ask you to also pay attention to the people that have been making responsible decisions, closing down every other table at their restaurant or reserving it so people can go in, have service, allow employment, allow social distancing to take place, and to responsibly enjoy what's happening. That's the majority of our operators. That's how they're behaving. That's been the encouragement and what we've seen. We'll continue to communicate on that, like I said, with public health at the forefront, but also with a concern for the working men and women of the state of Arizona.
Governor,
Thank you.